Pre-test guide for BRCA mutation. Meanings of the test result. Hello, this video was designed to explain the genetic testing, counseling, and screening procedures involved in the treatment of hereditary breast cancer. We hope it will help you understand the available options, and give you the information you need to make a decision that is right for you. There are 3 possible test results for a BRCA mutation. A BRCA mutation is identified. Risk of cancer development. Cancer does not occur 100% of the time in those who have a BRCA mutation. However, if a woman with a BRCA1 or BRCA2 mutation lives up to 70 years old, the risk of breast and ovarian cancer by age group are much higher. Additionally, if a person has a BRCA mutation, the risk of pancreatic cancer, prostate cancer, gallbladder cancer, stomach cancer may increase 2 or 3 times. Finally, if a woman with breast cancer in one breast has a BRCA mutation, the risk of breast cancer in the opposite breast is about 60% for the remainder of the patient's lifetime. How to counteract the risk of cancer. There is no way to replace a mutated BRCA gene with a normal gene. But it is possible to detect breast and ovarian cancer at early stages, through adequate cancer screening. You may also want to take a cancer-preventing drug, or get prophylactic surgery. Consultation with your doctors will help you to choose the best counteractive measures. Cancer surveillance. It is recommended that women with a BRCA mutation start self-breast examinations at an earlier age than ordinary women. It is also recommended that they go for routine breast examinations by a specialist, mammographies, breast MRI scans, and ovarian cancer screenings. Keep in mind that these are just different types of screening to detect cancer in the early stage. They are not a treatment or a prophylaxis of cancer. Chemical prophylaxis. Development and growth of breast cancer is known to be promoted by female hormones. Tamoxifen is a drug which interferes with the action of female hormones on breast tumors. It can help to suppress cancer recurrence in breast cancer patients, as well as prevent breast cancer development in high-risk women. If a healthy woman who has BRCA mutation takes tamoxifen prophylactically, the risk of breast cancer development can be reduced by 50%. If a woman who has had breast cancer in one breast takes tamoxifen prophylactically, the risk of breast cancer development in the opposite breast can be reduced by 50%. To reduce the risk of ovarian cancer, a woman might choose to take oral contraceptives. Taking oral contraceptives can reduce her risk of developing ovarian cancer by 50%. Unfortunately, both of these options have side effects. Tamoxifen may cause perimenopausal symptoms in young women, and increase the risk of thrombosis and endometrial cancer. Oral contraceptives are known to increase the risk of breast cancer. Thus, you should have a full consultation with a specialist before using these chemoprophylactic drugs. Prophylactic surgery. The final counteractive measure you can choose involves surgically removing the organ where the risk of developing cancer is high. Prophylactic surgery is the most definite cancer preventing method. However, surgery is permanent. Once it is done, it cannot be undone. Make sure to consult a specialist before choosing this option. Prophylactic mastectomy can reduce the risk of breast cancer by more than 90%. And if you choose to have breast reconstruction surgery, it can be performed simultaneously. Unfortunately, because breast tissue is widely distributed throughout the chest, some breast tissue may remain in the subcutaneous tissue and chest wall, even after mastectomy, and breast cancer may develop in the remaining breast tissue. Thus, prophylactic surgery cannot prevent breast cancer 100% of the time. Prophylactic oophorectomy can be done between the ages of 35 and 45, after childbirth. It can reduce the risk of ovarian cancer by about 97%, and reduce the risk of breast cancer by 50%. However, some patients may develop ovarian cancer in the ovarian tissue which remains in the abdominal cavity. Just like mastectomies cannot prevent breast cancer 100% of the time, prophylactic oophorectomy cannot prevent ovarian cancer 100% of the time. No BRCA mutation is identified. If no BRCA mutation is identified, there are 3 possibilities, which will be discussed shortly. Before we begin, however, it is important to note that, although a BRCA mutation has not been found, a family history of breast cancer, or development of breast cancer at a young age, may increase the risk of breast cancer in your family. Possibility number 1. It is possible that the cancer was caused by environmental and/or lifestyle factors, and not by a BRCA mutation. Unlike genetic mutations, environmental factors and lifestyle factors cannot be clearly identified, and thus, the risk cannot be accurately predicted. The second possibility is that the cancer was caused by a genetic mutation in another gene. BRCA is just one of many genetic mutations, which are related to breast cancer. However, there is not enough research data for these other mutations. And again, it is difficult to predict the risk of cancer. Possibility number 3. The last possibility is that a BRCA mutation might exist, but it was not identified with basic genetic test. The BRCA1 gene, located on chromosome 17, is composed of approximately 5,600 base pairs. And the BRCA2 gene, located on chromosome 13, is composed of approximately 10,000 base pairs. About 15% of the genetic mutations in BRCA cannot be identified with a basic genetic test. Depending on the patient, additional tests to identify large-scale genetic rearrangements may be required. Genetic abnormality is identified, but the correlation with breast or other cancers is not clear. Unclassified variants is a term used to describe a genetic abnormality, which we currently do not fully understand. In this case, the risk of breast cancer or other cancers cannot be determined. Currently, those who have what are considered unclassified variants of the BRCA genes do not need to take any preventative action. However, if cancer patients are relatively common in your family, it is advisable to pay constant attention and note any changes in your body. If you have any concerns, you can always contact your healthcare provider. Thank you for watching this pre-testing guide. We hope you found it informative.